So some of the novel treatments that are really exciting are some of the preventive medications. So the monoclonal CGRP medications, mAbs, and others like that are injectable. They've shown really good promise in the adults and have FDA approval. There are ongoing clinical trials for the use of these in pediatrics down through the age of 6. We are already using them somewhat off-label in some of these patients just because of how refractory they are and have seen anecdotally really good evidence, but it'd be really nice to see the literature to back up our experiences. But they've shown really good benefit with minimal side effects in our patients, so that's a really nice migraine prevention treatment option. They are increasing new rescue therapies, so oral CGRP blockers such as ubrogepant or megepant have shown up in the adult side as well as really helpful. As well as the lasmiditan and other ditins as well. They all have shown really good benefits rescue in adults. They're still off-label in kids as well, and there are also clinical trials for those that are going on, but we've been using them and shown great promise as well. So there's nice options to kind of keep patients out of the hospital and out of the ER for treatment and be able to kind of continue with their daily lives. Beyond that, we are kind of still going through the typical approaches for patients who present to like the ER and infusion centers doing IV migraine cocktails, valproic acid and DHE. And then, ketamine is increasingly an option for us, at least in the Children's Hospital of Colorado. We have a very helpful and good partnership with our pain team that helps us with that. So we can either do admissions for it, and sometimes we can do it as like a 3-day outpatient infusion center option, which is another option for treatment. So the devices are a growing field of research in pediatric headache, but they all seem to be likely very safe. They're just not all yet studied in pediatrics. The Nerivio device is like an armband that has a vagal nerve stimulator. And so the TMS devices, I've not had as much experience in pediatrics. They're a little bit harder. They're a little more cost prohibitive, but they're definitely a modality that has shown promise in the literature for the adult side.